let's talk about breast lump. Causes of breast lump. In case of below 10 years, it may be due to fibroadenoma, fibrocystic disease, mastitis, traumatic fat necrosis, and carcinoma of the breast. For 35 to 50 years, it may be due to fibrocystic disease, carcinoma of the breast, fibroadenoma, traumatic fat necrosis, and duct papilloma mastitis. Over 50 years of the age, it may be due to carcinoma of the breast, fibrocystic disease, traumatic fat necrosis, duct papilloma, and Paget's disease of the breast. According to the relation of the pain with lump, painless lump may be seen in fibroadenoma, cyst, carcinoma, and area of the fibroadenosis, and painful lump is seen in periductal mastitis, abscess which may be usually postpartum or lactational, and area of the fibroadenosis, cyst, and sometimes a carcinoma. Now, causes of the solid lump in the breast, which may be due to fibroadenoma, duct papilloma, fibroadenosis, carcinoma of the breast, and traumatic fat necrosis. Evaluation of the breast lump. History includes menarche, menopause, changes during the menstrual cycle, pregnancies, lactation, family history, and drug history. Examination includes exposing the trunk above the waist, inspecting the breast at rest, and asking the patient to raise her arm above the head, looking at the sides, site, shape, symmetry, and color. Feel includes surface depth, temperature, tenderness, age, consistency, and fluctuation. Skin includes puckering, purity orange, nodules, discoloration, ulceration, reducibility, and nipples and areola. Axilla, arms, and neck. Feel the normal side first. Examine the axilla and arms. Examine the supraclavicular fossa, and general examination should be done. Now, investigations. Imaging includes mammography to detect hidden lesion, which is not done in case of the lump. Doctography, ultrasonography, MRI, isotope bone scan, chest X-ray can be done. Biopsy includes large bore needle biopsy, open biopsy, and FNEC. Biomarkers include serum glutathione reductase, ornithine decarboxylase, proliferating cell nuclear antigen, and vascular endothelial growth factor, P53, human epidermal growth factor, and routine examination of blood. Now, triple assessment. In any patient who presents with a breast lump or other symptoms suspicious of carcinoma, the diagnosis should be made by a combination of the clinical assessment, radiological imaging, and a tissue sample taken for either cytological or histological analysis. This is called triple assessment of the breast lump. Importance of the triple assessment. Triple assessment increases sensitivity and specificity of the diagnosis of the breast lump and helps in staging and grading of the breast cancer. Now, painful conditions of the breast. Painful lump includes an area of the fibroadenosis, cyst, periductal mastitis, abscess, and occasionally a carcinoma. Pain and tenderness, but no lump is seen in cyclical breast pain, non-cyclical breast pain, or very rarely a carcinoma. End of the topic.